So we spend all of the time just like this with our phones in our hand, looking at our phones, and it is leading to an underreported epidemic. Millions of people have dry eye syndrome. Dr. Kevin G is an optometrist. He's here to talk about the problem and offer some solutions. Doctor, thanks for your time this morning.
Thank you for having me.
So first and foremost, what is dry eye syndrome itself? What is this?
So traditionally, dry eye syndrome has been defined as that gritty, sandy, irritated feeling in the eyes, and that's been going on for ages. Lately, we've seen things that have trickled from that, from anything from painful eyes to light sensitivity, and maybe even fluctuation vision, as well as decrease in quality of life in some of these studies.
Awesome. And then what about this device you have with us today, and that helps you retain moisture in your eyes?
Actually helps to restore moisture in the eyes. So as we see behind us, the images that we call the meibomian glands, and the meibomian glands are activated every time we blink. What's activated out of there is oil that comes out of the glands, and it comes to the surface to prevent the surface from evaporating. So with a device like the Forma-i treatment that we perform in the office, it's a gentle massage around the eyelid margin, right here at the exterior portion of the meibomian glands. And with that heat and radio frequency, it helps to express those glands and brings those oils to the surface.
How pivotal is this for your patients and really helpful for them who may deal with this syndrome?
It's amazing because so many different dry eye therapies, such as artificial tears, are just temporary relief. And this is something that allows for a longer lasting, sometimes even resurrected tear film. We've been doing this for this type of technology for probably about 10 years now. And as of recent, we upgraded to the Envision device that has really helped.
We have this before and after picture on the screen. So this is before and after they use the device you have?
Exactly. So on the left hand of the screen, you'll see the device applied to the outside of the lid, and what's a small footprint with very little to no downtime. Like folks will come in and have this done during their lunchtime or have this done and go back to kid activities. On the right side, you see some of the acute treatments that can be done, such as styes that arise from these meibomian glands when they get clogged, that the Forma-i is able to approach this in a non-surgical way to express those glands and bring resolution to that, which previously we'd have to typically express with a incision or use long-term heat therapy at home.
Wow, well, it sounds like this is very helpful, and so many people of all ages deal with this because we all look at our phones, we all sit in front of computers and all of that stuff.
I think you hit the nail right on the head because this is all ages, and we screen for this in the office from anybody from young to old to see these types of changes, and unfortunately a lot of times we're seeing this in younger patients.
Wow. All right, doctor, thank you for your time, and hopefully anyone watching that may be dealing with this issue, they'll know how to address it now. Thank you.
Thank you so much.